If you're past 70 and your doctor just congratulated you for getting your blood pressure down to 120 over 80, you need to stop and listen carefully. A major study followed more than 15,000 older adults for 5 years, and the results turned everything we think we know about blood pressure upside down. The seniors with ideal numbers didn't do better. They actually had a much higher risk of dangerous falls, and their overall survival was worse than people with slightly higher readings. Over the next 15 minutes, I'm going to walk you through the exact blood pressure range linked to the longest lifespan in older adults, why chasing the standard target can become risky after 75, and one simple test you can do at home tonight that could spare you a life-changing fall. I'm Dr. Michael Kent, and what I'm about to share could truly save your life or the life of someone close to you. Before we go any further, I want you to comment right now with just one thing: your age, nothing else. I want to know who's watching because this information applies very differently at 65 than it does at 75 or 85. And if you've ever felt lightheaded when standing up from a chair or getting out of bed, add the word dizzy to your comment. That detail matters more than you realize, and you'll see why in just a few minutes. Here's what's happening in clinics all over the country every single day. A 78-year-old comes in for a routine visit. The blood pressure reads 145 over 86. The doctor glances at the guidelines on the screen, sees that familiar target under 130 systolic, and immediately reaches for the prescription pad. One medication is added, then another. Over the next several months, the numbers come down beautifully, 124 over 78. The doctor is satisfied, the patient gets praised, everyone assumes this is a win. But here's what those guidelines don't take into account. That same 78-year-old gets up in the middle of the night to use the bathroom. Within seconds, their blood pressure drops from 124 over 78 to something like 88 over 56. The brain isn't getting enough blood. The room starts to spin. They reach for support and miss. And suddenly, we're no longer talking about numbers on a chart. We're talking about a broken hip, emergency surgery, weeks in rehab, and a chain of complications that often ends in loss of independence, or worse. Research published just months ago should have been everywhere, but most doctors haven't seen it yet. Most patients definitely haven't heard about it, and that gap between what science is showing and what's happening in everyday care is costing people their lives. Now, this is the part that's going to sound backward, and I need you to stay with me. This is where the story changes. For decades, the message has been simple. Lower blood pressure means better health. And for people in their 40s and 50s, that's mostly true. Controlling blood pressure in midlife reduces heart attacks, strokes, and kidney disease later on. The evidence there is solid. But after about age 75, something fundamental shifts. Studies now show that older adults with systolic blood pressure in the 130 to 145 range actually live longer than those pushed below 120. They fall less. They fracture fewer bones. They're hospitalized less often. Their thinking stays sharper. The group that hit that perfect 120 over 80 had more dizziness, more fainting episodes, more kidney problems, and higher death rates overall. If you're someone who wants to understand why, not just follow instructions, what I'm about to explain will completely change how you think about blood pressure as you age. Your heart and blood vessels at 75 are not just an older version of what you had at 45. They function differently, and those differences change what the numbers mean. There are three major age-related changes that matter here. First is arterial stiffness. As we get older, arteries lose elasticity. Think of a brand new garden hose compared to one that's been baking in the sun for decades. The older one is stiff and unyielding. Your arteries undergo a similar process. When blood is pumped into stiff arteries, they can't expand to cushion the pressure the way younger arteries do. That means you often need a slightly higher resting pressure to keep enough blood flowing to your brain and kidneys, especially when you're upright. Second is declining baroreceptor function. Baroreceptors are tiny pressure sensors in your blood vessels. When a younger person stands up, these sensors instantly detect the pressure change and signal the body to compensate. Heart rate rises, blood vessels tighten, pressure stabilizes. With age, these sensors respond more slowly. So if your baseline pressure is already low, standing up can cause a sudden, dangerous drop called orthostatic hypotension. Third is how medications are handled by the body. At 75, your liver and kidneys don't process drugs the way they did at 45. A dose that's reasonable for a middle-aged adult can be too strong for an older one. The medication stays in your system longer, acts more powerfully, and can drive blood pressure lower than your body can safely tolerate. Now let's talk about the actual data because the details matter. A large study followed over 15,000 adults older than 75 for about 5 years. These weren't unusually healthy seniors. They included people with diabetes, heart disease, prior strokes, and varying levels of frailty. Researchers tracked average blood pressure and then watched what happened over time. Participants were grouped by systolic pressure, below 120, between 120 and 130, between 130 and 140, between 140 and 150, and above 150. The group with the lowest death rate was the one between 130 and 140, not the lowest group, not the ideal number. Those below 120 had a 28% higher risk of serious falls requiring hospitalization. They had more acute kidney injuries, and their overall mortality was about 14% higher than the moderate group. Yes, very high pressure above 150 carried risks too, like more strokes and heart problems, but the shock was that pressure that was too low was just as dangerous. The safest range, the one linked to the longest life and best quality of living, sat right in the middle. You're 76. At a routine visit, your blood pressure reads 142/84. Your doctor frowns and says it needs to come down, ideally closer to 120. You start a medication. 2 months later, it's 128/78. That's good, but another drug is added to get it a little lower. A couple months later, you're at 122/76. Perfect, you're told. At first, you feel okay. Then you notice something odd. When you stand up to answer the phone, you feel briefly unsteady. When you rise from the dinner table, the room tilts for a second. You mention it at your next visit and are told it's just aging, to stand up slowly. What's really happening is that your pressure, which looks flawless sitting in the office, is dropping sharply when you stand, from 122/76 to something like 95/60. Your brain is repeatedly getting less blood than it needs. Your fall risk is high, but no one is checking because the seated number looks perfect. This happens thousands of times every day, and it's avoidable once we accept that blood pressure goals must be individualized, not universal. Here's what surprises most people. There's a simple 3-minute test that can reveal whether your treatment is putting you at risk for falls, and most clinicians don't do it routinely. It's called checking orthostatic vital signs. You can do it yourself tonight. You'll need a home blood pressure cuff. Lie down flat for 5 minutes and rest. While still lying down, check your blood pressure and write it down. Then stand up and immediately check it again. Don't wait. Compare the numbers. If the top number drops more than 20 points or the bottom number drops more than 10, that's orthostatic hypotension. It's a warning sign. For example, lying down, you might be 125/78. Standing up, you drop to 98/64. That's a significant decline. Your brain isn't getting enough blood when you're upright, which is when you spend most of your day. This is the test that should be done regularly in anyone over 70 on blood pressure medication. If it isn't, you can bring these results to your doctor yourself. So what should your blood pressure actually be? Research suggests ranges, not rigid rules. For generally healthy adults between 65 and 74, a systolic range of about 130 to 140 balances protection and safety. For those between 75 and 84, evidence supports something slightly higher, around 135 to 145. For adults over 85 or anyone who is frail, 140 to 150 may be more appropriate, with the focus on avoiding falls and preserving independence. The bottom number matters too. In older adults, diastolic pressure should usually stay above 65, ideally between 70 and 85. Consistently low diastolic readings can reduce blood flow to the heart itself. Consider someone who is 73, has type 2 diabetes, and had a heart attack years ago. Their pressure is 148/86. Should they aim for 120/80? Probably not. Should they ignore it completely? Also no. A target around 130 to 135, reached slowly and monitored carefully, may offer the best balance. Blood pressure also changes throughout the day. One high reading doesn't tell the full story. That's why home monitoring is so valuable. It shows your true average, not just a snapshot in a clinic. You might wonder why your doctor hasn't talked about any of this. Part of the reason is that guidelines change slowly. The studies that made 120 over 80 famous focused mostly on middle-aged adults. For years, those targets were applied to everyone. Only recently have researchers focused on older populations and discovered that one size doesn't fit all. There's also habit and psychology. Doctors have spent decades learning that lowering blood pressure saves lives. Shifting to a more nuanced view takes time, especially in a system where visits are short and individualized care is harder to deliver. Let me show you how different two people the same age can be. Both are 81. One has heart failure, kidney disease, and arthritis. Blood pressure is 158 over 88. Aggressive treatment could cause dizziness, kidney decline, and falls. A more cautious approach might accept a higher target. The other 81-year-old is active, healthy, and plays golf twice a week. Same numbers, but a different plan might make sense. Same age, same reading, different people. This is treating the person, not the number. Here's what you can do starting tonight. If you're over 70 and on blood pressure medication, get a home monitor. Check morning and evening for 2 weeks and log it. Perform the lying to standing test. Pay attention to symptoms like dizziness or fatigue. Schedule a visit to discuss your personal target, not a generic one. And if medications make you feel unwell, speak up. Adjustments can often be made. What you now understand is something many people don't. Blood pressure goals aren't universal. For older adults, especially over 75, moderate systolic pressure often leads to better survival and quality of life than pushing numbers too low. The danger isn't just high blood pressure. It's blood pressure that drops too much when you stand. You now have the knowledge to talk to your doctor as a partner, not just a patient. If this gave you clarity, comment, informed. Share this with someone over 65 who needs to hear it. Subscribe if you want research-based guidance that actually applies to real life. In the next video, I'll break down which supplements truly support healthy blood pressure and which ones are a complete waste of money. You won't want to miss it. This video is for educational purposes only and is not a substitute for medical advice. Blood pressure management must be personalized. Never change medications without consulting your healthcare provider. Always discuss treatment decisions with a qualified professional.